The Tuskegee Syphillis Study stands as a dark chapter in American medical history, a stark reminder of the ethical breaches that can occur in the name of science. It began in 1932 in Macon County, Alabama, a region marked by deep poverty and racial segregation. The study focused on black men living in the area, specifically targeting those who were most vulnerable. These men were poor and mostly illiterate sharecroppers, struggling to make ends meet in a harsh economic climate. They were chosen for a study at the Tuskegee Institute, a historically black university known for its contributions to education and research. The researchers told the men they were being treated for bad blood, a vague term that encompassed various ailments. Bad blood was a common term for various ailments including syphilis, anemia, and fatigue, making it easy to mislead the participants. Syphilis is a serious sexually transmitted disease that can cause severe health issues if not treated properly. It can cause long-term complications if left untreated, including damage to the heart, brain, and other organs. The Public Health Service, a government agency, wanted to study syphilis's natural progression, believing it would provide valuable data. The study was supposed to last 6 months and involve medical exams and treatment, but the reality was far different. However, it continued for 40 years, and the men never received proper care. Instead, they were left to suffer the ravages of the disease, unaware of the true nature of their condition. The researchers from the Public Health Service used deception to get the men to participate. The men were not told they had syphilis. Instead, they were told they were being treated for bad blood. The researchers promised free medical care, meals, and burial insurance. This was a powerful incentive for these impoverished men. The researchers never obtained informed consent from the participants. This means the men never fully understood the study's risks and benefits. They were not given the opportunity to refuse to participate. The researchers actively misled the men about their condition. They also withheld information about the available treatment for syphilis. The most egregious ethical violation of the Tuskegee Syphillis Study was the withholding of treatment. By 1947, penicillin had become the standard treatment for syphilis. Penicillin was a highly effective cure for the disease. However, the researchers did not offer penicillin to the men in the study. The researchers wanted to continue observing the disease's progression. They were more interested in collecting data than in providing care. The men were subjected to painful and unnecessary procedures. These included spinal taps, which were said to be part of their treatment. The researchers' actions were a betrayal of the trust placed in them as medical professionals. The untreated syphilis had devastating consequences for the men in the study. Many of the men experienced severe health problems. These problems included heart disease, blindness, mental illness, and death. The disease was also passed on to their wives and children. The study cast a long shadow of mistrust on the medical community, particularly among African Americans. The Tuskegee Syphilis Study became a symbol of racism in medicine. It highlighted the vulnerability of marginalized groups to exploitation. Section 5. Public Exposure and Outrage. The Tuskegee Syphilis Study remained hidden for decades. Then, in 1972, a whistleblower named Peter Buxton brought the study to the attention of the public. Buxton was a former venereal disease investigator for the Public Health Service. He was morally outraged by what he had learned about the study. Buxton's revelations sparked public outrage and condemnation. People were horrified to learn that the U.S. government had conducted such an unethical study. The media played a crucial role in exposing the study's atrocities. The New York Times published a front-page article about the study, bringing it to national attention. Section 6. Seeking Justice and Accountability. In the wake of the study's exposure, the government shut it down. The National Research Act of 1974 was passed. This act created the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. The commission was tasked with developing ethical guidelines for research involving human subjects. A class action lawsuit was filed on behalf of the study's participants and their families. The lawsuit alleged that the government had violated the men's constitutional rights. In 1974, a $10 million settlement was reached. The settlement provided lifetime medical benefits to the surviving participants and their families. Section 7. A President's Apology. In 1997, President Bill Clinton issued a formal apology for the Tuskegee Syphilis Study. Clinton acknowledged the government's role in the study and expressed remorse for the harm inflicted on the men and their families. His apology was a significant step towards acknowledging the injustice of the study. Clinton's apology was a long time coming. It was an important moment of reckoning for the nation. The apology helped to bring some measure of closure to the survivors and their families. Section 8. The Aftermath and Lasting Impact. The Tuskegee Syphilis Study, a dark chapter in medical history, left an indelible mark on the field of medical research ethics. The unethical practices and gross violations of human rights during the study led to widespread outrage and a call for reform. This outcry had a profound impact on how medical research is conducted today. One of the most significant outcomes was the establishment of institutional review boards, or IRBs. These boards were created to ensure that no research study involving human subjects would ever again proceed without rigorous ethical oversight. IRBs are responsible for meticulously reviewing and approving research studies involving human subjects. They scrutinize every aspect of a study to ensure that it adheres to ethical standards and that the rights and welfare of participants are safeguarded. This includes ensuring that participants are treated with respect and dignity throughout the research process. The role of IRBs is crucial in maintaining public trust in medical research. The Tuskegee Syphilis Study also brought to light the critical importance of informed consent. Before this, many participants in medical studies were not fully aware of what they were agreeing to. Informed consent requires that researchers provide potential participants with comprehensive information about the study. This includes details about the study's purpose, procedures, risks, and benefits, allowing individuals to make an informed decision about their participation. The legacy of the Tuskegee Syphilis Study serves as a constant reminder of the need for ethical vigilance in medical research. It underscores the importance of transparency, respect, and the protection of human rights in all research endeavors. Section 9. Lessons Learned. The Importance of Informed Consent. The Tuskegee Syphilis Study serves as a stark reminder of the importance of ethical considerations in medical research. It underscores the need for informed consent, transparency, and respect for the dignity of all research participants. The study's legacy continues to shape the way medical research is conducted today. The Tuskegee Legacy Project was established to address the study's long-term consequences. The project aims to improve healthcare access and quality for African Americans in the Black Belt region of Alabama, where the study took place. Section 10. Safeguarding Ethical Research Practices. In the realm of medical research, maintaining ethical standards is paramount to ensure the integrity and trustworthiness of scientific findings. The Tuskegee Syphilis Study is a cautionary tale about the potential for abuse in medical research. This infamous study, conducted between 1932 and 1972, involved the unethical treatment of African American men who were misled and denied proper medical care. It is a reminder that ethical principles must guide all stages of research, from study design to data collection to the dissemination of findings. Researchers must adhere to principles such as informed consent, beneficence, and justice to protect participants. The study's legacy serves as a constant reminder of the need to protect the rights and welfare of all research participants. Ensuring that participants are fully informed and voluntarily agree to partake in research is crucial. The Tuskegee Syphilis Study also highlights the importance of diversity and inclusion in medical research. It underscores the necessity of involving a broad spectrum of participants to ensure that findings are applicable to all segments of the population. Researchers must ensure that their studies are representative of the populations they aim to serve. This means actively seeking out and including individuals from various backgrounds, ensuring that the research benefits everyone. This includes recruiting participants from diverse racial and ethnic backgrounds, which helps to eliminate health disparities and improve the generalizability of research findings, as well as addressing potential biases in study design and data analysis. By recognizing and mitigating these biases, researchers can produce more accurate and reliable results, ultimately advancing the field of medical science in an ethical and responsible manner. Section 11. Remembering Tuskegee, a call for vigilance. In conclusion, the Tuskegee Syphilis Study remains a painful reminder of the ethical transgressions that can occur when medical research is conducted without regard for human dignity and well-being. The study's legacy continues to inform and shape the ethical landscape of medical research today. We must remain vigilant in our efforts to prevent such atrocities from happening again. We must remember the lessons learned from Tuskegee and work towards a future where medical research is conducted ethically and with the utmost respect for all human beings.